Everyone feared the hospital CEO, but the night a rookie nurse stood up to him the truth in that ICU changed forever. Have you ever known you were right, felt it in your bones, and still stayed quiet because the people in power were louder, older, and impossible to challenge? This story goes straight into that fear. San Antonio, Liberty Cross Medical Center. Night shift. Fluorescent lights. Monitors pulsing like distant gunfire. A decorated general is fading after surgery, a room full of top doctors is arguing over the wrong problem, and in the corner stands a young nurse with battlefield instincts no one respects yet. What happened next was not just a medical emergency. It was a test of courage hierarchy and who actually saves lives when seconds matter. Watch to the end then, like this video, and comment where you're watching from. That room did not become dangerous all at once. It had been building toward that moment for hours, maybe for years, in ways most people never noticed until the air turned tight and somebody important stopped looking stable. Liberty Cross Medical Center sat on the north side of San Antonio like a fortress dressed up as a hospital. The glass front shone blue at night. The lobby floors were polished so bright they reflected the ceiling lights like still water. Donor plaques climbed the walls in neat brass rows. Veterans with silver hair moved through the halls beside men in tailored suits, and women carrying leather folders stamped with names that opened doors in Washington. Helicopters came and went from the roof. Black SUVs waited at the private entrance. People did not come to Liberty Cross for ordinary care. They came there when power needed privacy and money expected survival. Inside the building, the cardiac tower ran on a different kind of gravity. Day shift belonged to consultants, administrators, family meetings, and polished language. Night shift stripped all that away. By 7 in the evening, the floors got quieter. The light got colder and the real shape of the place showed itself. Doors side open and shut. Medication carts rolled over waxed tile. Ventilators breathed in patient rooms with the slow mechanical patience of machines that never got tired. Nurses moved in pairs and then alone. Residents walked fast with their eyes already burned from screens and fluorescent light. Somewhere down the hall an alarm would chirp, get silenced, then return like a thought no one wanted to finish. The cardiac intensive care unit occupied the 12th floor behind locked glass doors, and a second layer of badge access that clicked open with a sharp military certainty. The unit was designed for precision. 8 private rooms curved around a central station where monitors glowed in rows. Every sound had a purpose: the steady pulse of telemetry, the hiss of oxygen, the muttered call for a lab draw, the soft rip of tape from a dispenser. At 3 in the morning, the place could feel like a submarine. At 6:47 in the evening, with a donor patient fresh out of surgery, it felt more like a command bunker waiting for incoming fire. Ava Bennett had learned the unit by sound before she learned it by routine. 93 days into the job, she could already tell which ventilator settings belonged to the post-op hearts, which alarms were nuisance alarms, and which change in tone meant a patient was stepping off a cliff no monitor had fully measured yet. She had learned which senior nurse trusted her enough to ask for help, and which one corrected her in front of residents because that was how pain moved downward in places like this. She had learned where to stand when attendings entered a room, how to keep her chart close to her chest, and how to make herself useful without taking up space. That last part was the hardest. In photographs from nursing school, Ava looked younger than 28. The camera never captured the parts that counted. It did not show the discipline in the way she stood with weight balanced evenly on both feet. It did not show the habit of scanning exits, hands, chest movement, eyes. It did not show the old reserve she carried into new rooms, the instinct that kept her voice low and her attention wide. At Liberty Cross, most people saw a quiet new nurse with neat handwriting and a habit of checking things twice. They did not know what else had taught her to be careful. Before the scrubs and name badge, before the laminated orientation packet, and the smiling photo on her employee ID, Ava had spent 6 years in the Army Reserve. She enlisted at 19. Combat medic. Training first in Georgia, then deployments that never turned into the kind of stories people wanted at dinner tables. The official descriptions always sounded clean. Stabilization, evacuation support, route coverage, triage. Reality smelled like dust diesel, blood-wet canvas, burned metal, and adrenaline so sharp it made time stutter. Reality was learning the difference between panic and urgency, learning what bodies did when fear hit before pain, learning that some people went loud before they collapsed and some went quiet first. She had carried those lessons home whether she meant to or not. Nursing school gave them language. Civilian medicine gave them hierarchy. Trauma rotations gave them familiar chaos under better lighting. But the deepest thing she had learned did not come from a textbook or a simulation lab. It came from a medic instructor in a gravel yard during summer heat, a staff sergeant with sunburned ears and a voice like sandpaper who stopped a training scenario halfway through and pointed at a monitor while a mannequin bled fake blood into the dirt. "Do not marry the screen," he had said. "The machine reports. The body confesses." Ava never forgot that. Still, Liberty Cross did not care much about where she had been before she showed up on their payroll. Civilian hospital culture had its own chain of command, and this one ran deep. The new nurse listened. The senior nurse decided when to trust her. Residents could brush her off without much cost. Attendings did not need to look at her unless they wanted something. The unit secretary knew more than half the residents and got less respect than any of them. Experience mattered, but visible power mattered more. And above all of it stood Dr. Nathan Crowe. People said his name differently depending on what floor they worked on. Administrators called him strategic. Donors called him visionary. Reporters called him disciplined, which was a polite way of saying he answered questions like he was clearing a room. Nurses used fewer adjectives. Residents used none when he was anywhere near them. In private, they called him many things, but the one that lasted was simple. Crowe, one word, like weather, like a warning. He had the kind of reputation that became folklore inside a hospital. Former Navy trauma surgeon, though others said he had spent so much time operating with Army units that the branch barely mattered. Built field hospitals overseas under conditions that made ordinary complaints sound obscene. Took over Liberty Cross after a string of highly publicized lawsuits and turned it profitable without softening it. His standards were ruthless. His memory was worse. He remembered names, outcomes, and excuses, and only one of those could save you in a meeting. A respiratory therapist once said Crowe could walk into a room and lower the temperature by 10 degrees without changing his expression. No one laughed. The therapist was only half joking. Ava had met him once before from a distance of 3 feet, her second week on the unit. She was carrying fresh IV tubing and moving too fast, trying to cover for a delayed transfer when the elevator doors opened and Crowe stepped out with 2 board members and a man from legal. Ava froze in place, caught between stepping around him and backing away too visibly. Crowe looked at the tubing in her hand, then at her badge. "Nurse Bennett," he said, reading it once. "If you are running, something has already gone wrong." His tone held no anger. That somehow made it worse. Ava straightened. "Yes, sir." He looked at the tubing again. Then fix the right thing, not just the fast thing. He walked on. Board members behind him. Shoes quiet on marble. She stood there for 2 seconds after he was gone, pulse jumping in her neck before realizing what he had meant. She had grabbed standard tubing when the patient needed pressure-rated line. He had noticed it in one glance while speaking to 3 other people. From then on, she checked everything twice and never forgot what his voice sounded like when he was calm. By the time this particular night began, she had already been on the floor for almost 11 hours. The shift had started early with a transfer from step down a family meeting that ran long 2 dressing changes, 1 line issue, and a post-op patient in bed 5 who did not understand why he could not have water yet and took that personally. The charge nurse Marisol Trent moved through the unit like a seasoned first sergeant, one eye on staffing, one eye on the board, and somehow two more on everyone's emotional stability. She liked Ava in the practical way competent women recognized each other. Not with praise. With trust tested in increments. At 5:20 that afternoon, Marisol stepped out of the glass office and called Ava by name. "You're with me on Pike." Ava looked up from charting. "General Pike, unless another 4-star materializes in the next 30 seconds. Ava set down her pen. "Yes, ma'am." Marisol gave her the look she used when she was about to say something important without repeating it. "This one will be crowded. Keep your head. Watch the room, not just the patient." That last line stayed with Ava as they prepped Bed 9. General Warren Pike had arrived in a security bubble that began downstairs and tightened as it moved up. Retired 4-star Marine general, decorated combat commander, cable news regular, philanthropist, the sort of man whose face looked familiar even if you had never followed military affairs in your life. His foundation-funded veteran housing scholarships, rehabilitation centers, and more relevant to everyone on the 12th floor, a wing of Liberty Cross named after his late wife. Donor, public figure, survivor of things most men only read about. Now 73 years old and fresh out of a triple bypass performed by the hospital's most celebrated cardiac attending, Dr. Ethan Caldwell. If Crowe inspired fear by restraint, Caldwell inspired loyalty by performance. He was the face families wanted after a successful operation. Tall, silver at the temples, voice smooth enough to make bad news sound organized. He had the gift of confidence and knew it. Some men wore status loosely. Caldwell wore it like a custom suit. His outcomes were excellent. His research was cited. His photographs appeared in magazines about innovation in surgery, always in crisp coats, always with folded hands and direct eye contact. Residents competed for his approval because his recommendation letters changed futures. Nurses tolerated him because he was usually right, and because men like him rose faster than complaints did. Ava had only worked with Caldwell twice before. He had not learned her name either time. General Pike returned from surgery just before 6. The room filled fast. Caldwell at the bedside. 3 residents just behind him, each trying to be useful before being told what useful meant. Respiratory on the ventilator settings. An anesthesiologist finishing handoff. Marisol checking infusions. Ava documenting initial post-op numbers and assessing drains lines, skin temperature, pupils, chest expansion, distal pulses. Everything crisp at first. Sedated, stable enough. Expected blood pressure support. Expected pain response muted by sedation. Expected post-op tightness. The language of recovery still within reason. Then came the subtle changes. Pike's heart rate edged upward. Not dramatic at first, just enough to pull attention toward the monitor. A number in yellow becoming a number in orange. One resident pointed it out. Caldwell responded without looking worried, which made everyone else less worried on instinct. There were theories immediately. Pain. Catecholamine surge. Rhythm irritability after bypass. Electrolytes. Volume shift. The room began to lean toward the heart because that was Caldwell's battlefield, and because the heart was where the loudest numbers were. Ava charted, listened, looked. The monitor showed 98% oxygen saturation, then 97, then 96. She watched the trend line more than the number itself. Downward, slow, smooth. Unimpressed by everyone's certainty. She looked at Pike's face. Sedation clouded expression but did not erase strain. A faint pull in the neck. A slight effort around the jaw. Not enough for alarm, enough for attention. Marisol noticed Ava watching and moved closer. "What are you seeing?" Ava kept her voice low. "He looks tighter on the left." Marisol glanced once, quick and experienced. "Could be splinting. Keep an eye on it." Not dismissal, not full agreement, just acknowledgement stored for later. That alone mattered. Ava nodded and returned to her chart, but her focus had shifted. She checked the ventilator pressures again. A little higher. Not screaming. Building. Across the bed, Caldwell was talking through management with the residents, every word polished by years of being obeyed. Let us not overreact to routine post-op instability. The body does not read our timing charts. One resident gave a respectful half-smile like he had just been handed a quote worth remembering. Ava disliked quotes in critical care. Too many people remembered phrasing better than patience. By 6:35, the unit had settled into that dangerous version of calm, where everyone was busy enough to think the important things were covered. Bed 3 needed a medication clarification. Bed 6 had a family member crying softly behind the curtain. Pharmacy called with a substitution issue. The charge phone rang twice. Somewhere down the corridor, a transport team laughed too loudly and then lowered it when they realized where they were. In Bed 9, Pike's heart rate stayed elevated. Oxygen saturation held in the mid-90s, which was still acceptable if you wanted to be reassured. Airway pressure rose again. Ava checked his chest with her eyes first, then with a hand close enough to feel the timing of expansion through the blanket and gown. Right side? Left side. Tiny difference. There and gone. She watched for another breath. There again. She asked, respiratory, a young man named Ellis. Has he been fighting the vent? Ellis looked at the screen. Not really. Slight increase in pressure, but not ugly. Can you suction and reassess? Ellis shrugged lightly. I can, but Caldwell is in there and thinks this is cardiac. That sentence settled in Ava like a stone. She looked over at Caldwell. He was still at the center of the room, still speaking in controlled tones, still owning the oxygen in the space simply because everyone had agreed he did. Then the unit secretary sat up at the central desk and said almost under her breath, Crowe's on 12. The effect was immediate. A resident straightened. Another closed a chart that had been left open on the counter. Someone smoothed a blanket that did not need smoothing. Marisol glanced at the glass doors, and then at Bed 9 as if recalculating the whole evening in one breath. Ava felt it too, not panic, compression. Through the glass, Dr. Nathan Crowe moved down the hall with a deliberate pace that made other people step aside before they knew they were doing it. No escort now. No board members. Just Crowe in a dark suit with his jacket off sleeves, crisp hospital badge, clipped to his belt, walking as if every corridor belonged to him because he had already paid for it in harder places. He stopped once outside Bed 7 to speak quietly to a nurse about a medication discrepancy. Not a wasted word, not an extra nod. Then he continued toward Bed 9. Caldwell saw him coming and changed almost imperceptibly. Still confident, but sharper now, more alert. Men with authority recognized other kinds of authority immediately. Marisol leaned closer to Ava. Stay with your patient. I am. Then, stay there. The double doors to Pike's room opened. Crowe entered. No one introduced him. No one needed to. His gaze moved from the chest tubes to the arterial line, from the ventilator to the monitor, from Caldwell to the patient. He took in the room the way experienced officers read maps. No rush, no visible emotion, just assessment. Caldwell began the summary efficient and controlled. General Pike returned from bypass 40 minutes ago. Hemodynamics broadly stable. Mild tachycardia. We are evaluating for expected post-operative causes before escalating intervention. Crowe listened without interrupting. That was somehow more unnerving than any interruption would have been. Ava stood near the left side of the bed chart against her hip eyes on Pike. The oxygen trend touched 95. Nobody reacted, because 95 after major cardiac surgery could still be explained. Because major complications were supposed to announce themselves more dramatically. Because rooms full of experts often trusted what fit their expectations more than what disturbed them. Ava felt the old training rise up in her with uncomfortable clarity. The body confesses. Watch the chest. Watch the work of breathing. Watch the slow drift nobody wants to honor until it becomes a cliff. Pike's neck muscles tightened again with the next breath. Ava heard herself inhale. Crowe had still not spoken. Caldwell was discussing rhythm management with one resident and post-operative bleeding risk with another, pulling the room toward abstractions, while the man on the bed kept fighting something more immediate. Ava glanced once at Marisol. The charge nurse's face gave nothing away, only the smallest flick of the eyes toward the patient, then back to Ava. "See what you see. Stand in it if you mean it." The monitor glowed steady and indifferent. 95. Ava looked at the chest. The left side lagged again. She looked at the airway pressure curve. Higher. She looked at the old general's hands, at the faint pallor turning strange around the nail beds. Then, in the room where everyone feared the CEO, and nobody wanted to challenge the attending, Ava Bennett opened her mouth and finally put words to the one thing no one else was willing to say. "Sir, his oxygen trend is dropping." The sentence was small when it left Ava's mouth. It did not sound like the kind of sentence that should stop a room. It sounded almost too quiet to belong in a room packed with senior physicians' machine noise and a patient whose name mattered to half the state of Texas. No one answered it. Caldwell kept his eyes on the cardiac monitor. One resident followed his gaze with obedient intensity. Another was already scrolling through lab values on a tablet. Respiratory stood by the ventilator with one hand on the rail, waiting to be useful in the direction authority chose. Ava felt the heat rise in her face anyway, not from embarrassment yet, from the effort of holding still. Crowe turned his head slightly in her direction, but he said nothing. Caldwell lifted one finger toward the screen as if conducting the room. "His saturation is still acceptable," he said. "What I care about right now is why his rate is still climbing." He spoke with the confidence of a man whose thoughts arrived pre-approved. His tone did not sharpen. It did not need to. Around him, everyone understood that the matter had already been settled because he had settled it. Ava looked back at General Pike. Acceptable. The word sat wrong in her mind. She had heard it too many times in too many places. Acceptable pain, acceptable blood loss, acceptable delay, acceptable numbers right up until a body crossed some invisible line and became a full emergency as if the danger had not been there all along, making itself known to anyone willing to see it early. Pike took another breath against the ventilator. The right side of his chest rose first. The left followed just late enough to matter. Ava stared, forcing herself to ignore the noise in the room. Another breath. Same delay. Her fingers tightened around the clipboard. Marisol stepped closer to the foot of the bed, pretending to check an infusion pump. Her voice, when it came, was so low only Ava could hear it. "You sure?" Ava kept watching the chest. "Not fully. But I do not like what I am seeing." Marisol's eyes flicked over Pike's neck, then to the ventilator, then back to Ava. The charge nurse did not say yes. She did not say no. She gave Ava the look seasoned people used when they knew certainty was still forming, but danger did not care whether it had paperwork yet. "Then keep looking," she said. Caldwell was still walking the residents through postoperative causes of tachycardia. Pain is the obvious driver. Volume shifts are also in play. I want another gas and a repeat potassium. We are not going to invent a complication because a monitor twitches. One of the residents smiled, faintly eager, almost admiring. "Yes, doctor." Ava hated the smile more than the words. She moved to Pike's left side and checked the chest drains again. Output had not spiked. Dressing clean. No obvious flood of fresh blood. The arterial line waveform still looked usable. Blood pressure holding with support. Not reassuring exactly, but enough to keep the room attached to the wrong story. Pike's skin had taken on a different quality under the lights. Not blue, not dramatically pale. Just a dulling of color, like warmth retreating from the surface. She leaned closer and counted respirations manually, even though the ventilator already displayed a number. 1, 2, 3, 4. She timed the rise, the pause, the mechanical push, the slight resistance in the pattern. Ellis noticed her counting. "You seeing vent desynchrony?" he asked quietly. "Maybe, maybe not." Ava glanced at the screen. What was his peak pressure when he came in? Ellis tapped through settings. 22. And now, 30. Ava looked at him. Ellis looked back, the first crack of concern finally touching his face. It has been climbing. You told anyone? He shifted, uncomfortable. Not as a problem yet, because Caldwell thought the problem was elsewhere. Because once a powerful physician named the direction of concern, everyone in the room began building around it, whether the patient agreed or not. Ava looked over at Crowe. He stood at the foot of the bed with one hand lightly touching the rail, not speaking, not intervening, watching the room, the way a field officer watched people before deciding which one actually understood the map. The residents kept talking. The words layered over one another. Arrhythmia, pain response, electrolyte replacement. Postoperative stress. The patient kept breathing like the left side of his chest had become heavier than the right. Ava leaned in closer, eyes narrowing. She watched the clavicles, the sternum, the movement beneath the gown. Tiny things, fractions, details so small they looked imaginary if you did not trust your own attention. Then she saw Pike's neck pull again. Accessory muscle use. Not much, enough. Her pulse slowed in a way it always had when fear and focus reached the same point. Not faster, colder, cleaner. She had felt that same shift years ago inside a dust-coated casualty collection point in western Iraq, when a corporal with a chest wound kept insisting he was fine while one side of his ribcage moved wrong and his pulse climbed against reason. Everyone had been waiting for the obvious signs then, too. The obvious signs had nearly arrived too late. The memory came back with brutal clarity. Harsh light, generator noise, hands slick in gloves, a medic lieutenant saying, "Get me a needle now." The sound air made leaving a body under pressure. The corporal's eyes, after stunned and angry at almost dying, quietly. Ava blinked once and brought herself back to bed 9. Same pattern. Different room, better equipment, higher profile patient. Same body language from everyone who wanted another explanation because the right one was inconvenient. She looked toward Caldwell. "Doctor." Nothing. Louder now. "Dr. Caldwell." He turned halfway annoyed this time. "Yes, Nurse Bennett." The room felt smaller instantly. Residents went still without meaning to. Even Ellis pulled his hand off the vent rail. Ava kept her voice controlled. "His airway pressure has risen 8 points since arrival. Left chest expansion is delayed. I think we should reassess the lungs." Caldwell stared at her for one beat too long. Then he gave a short, humorless exhale. "You think we should reassess the lungs?" It was not a question. It was an indictment dressed as repetition. Ava did not move. "Yes, sir." He took one step toward her, not aggressive enough to be dramatic, just enough to make his rank physical. "This patient returned from cardiac surgery less than an hour ago," he said. "He has a predictable postoperative tachycardia pattern and acceptable oxygenation. What I do not need in this room is a novice nurse confusing vigilance with diagnosis." The resident said nothing. Marisol's face hardened by 1 degree. Ellis stared at the vent. Ava felt the words hit and kept standing there. "I am not diagnosing," she said. "I am saying the respiratory picture is changing." Caldwell's jaw flexed. "Then chart your observations and allow the clinical team to interpret them." The clinical team. As if she had wandered into the room from the parking lot. Crowe still had not spoken. That silence became its own pressure. Ava could not tell whether it made things better or worse that he was watching all of it. Another breath. Right side first, left lagging. Another. Peak pressure up again. Ava looked at Ellis. "Can you bag him briefly and compare resistance?" Ellis hesitated. "I need the order." Caldwell heard that. "No. You do not. He remains on current settings." He turned back to the residents as if the interruption had been a cough. The conversation resumed, but something had changed in it. The rhythm was slightly off now, like a formation after one soldier breaks step and everybody pretends not to notice. Ava stepped back half a pace, not surrendering, just widening her view. She scanned the whole patient from head to toe. Collarbone, neck, chest, drains, abdomen. Tubing line dressings monitor trends, waveform, character, skin. She forced herself to drop every assumption and rebuild the scene from the body outward. Heart rate elevated. Oxygen drifting down slowly. Airway pressure rising steadily. Left side chest rise reduced. Color worsening. No obvious massive hemorrhage. No sudden arrhythmic catastrophe. No dramatic alarm to justify immediate panic. She watched Pike's trachea. A tiny suggestion. Not enough to swear to yet. Enough to make her stomach pull tight. She remembered another instructor, this one in civilian trauma rotation in Chicago. A night nurse who had worked county medicine for 20 years and could read a room faster than residents could read CT scans. The woman used to say that the first question in any deterioration was not what diagnosis sounds clever. It was, what can kill this patient in the next 3 minutes while everyone is still explaining themselves? Ava asked herself that question now. What kills him fast? Not a textbook list. Not 10 possibilities. 1. Pressure. Mechanical collapse. Air trapped where it should not be, each breath adding more force inside the chest until circulation starts failing and the numbers people trust stop telling the truth in time to matter. She moved to the ventilator and looked at the flow loops more closely. Ellis let her. He had begun to trust what he was seeing too, but not enough to challenge the hierarchy first. "Tell me if this looks normal to you," she said quietly. Ellis frowned at the screen. "No." "Tell him." Ellis swallowed. "Caldwell already heard me mention the pressure. That is not the same as telling him it is wrong." Ellis did not answer. Ava understood. It was not cowardice exactly. It was institutional gravity. People learned very quickly which objections were considered teamwork and which ones became career-defining mistakes. General Pike was not just any patient. Every person in that room knew a bad outcome would echo into board meetings, donor calls, news coverage, legal reviews. When stakes rose, the instinct to defer to authority got stronger, not weaker. Pike's saturation fell to 94. The numbers seemed to brighten on the screen. One of the residents noticed. "He's dropping." Caldwell stepped in closer. "Increase oxygen support. Repeat gas. I want another set of labs now." He was reacting, but still in the same lane. Numbers leading. Body trailing. Ava heard her own breathing. Slow in, slow out. Marisol shifted beside her. "If you are going to push clean." Ava turned slightly. "You see it too?" Marisol looked at Pike for 2 seconds. "I see enough not to like this room." Then she moved away to clear medication tubing from the side rail, creating space without calling attention to the fact that she was creating space. Crowe's gaze tracked that movement. Ava felt it. He was not missing anything. Not the patient. Not Caldwell's certainty. Not the way the staff redistributed themselves around risk. Not her. Pike's fingers twitched once under the sheet. Sedated, but not absent. The old general was still in there somewhere, body fighting while the room debated terminology. Ava leaned close to his chest and listened at the left apex with her stethoscope. Machine noise made it imperfect. Still, the sounds were diminished there. Not gone. Reduced. She listened again lower down. Worse. She checked the right side for comparison. Better aeration. She straightened. Ellis saw her face. "What?" "Reduced on the left." "You sure?" "No," she said. "Enough." Caldwell had begun ordering a low-dose adjustment for rate control. Ava turned toward him. This time she did not wait for an opening. "Dr. Caldwell, I need you to listen to his left lung." The room stopped. The sentence landed differently than the first two. It was not a suggestion anymore. It was a direct request in front of everyone. Caldwell looked at her with open irritation now. "I beg your pardon." Ava held his gaze. His airway pressure as climbing breath sounds are reduced on the left and his chest rise is asymmetric. "I need you to assess him for a pulmonary issue." One resident looked down at the floor. Another kept staring at the monitor as if he could escape into data. The third looked between Caldwell and Crowe with the frozen look of a young officer realizing no good move remained. Caldwell stepped toward Ava until only the bed rail separated them. "Nurse Bennett," he said softly, which was worse than shouting, "You are out of line." Ava felt every eye in the room on her, felt her own pulse in her hands, felt the old familiar split between the part of her that wanted to avoid humiliation and the part that had seen too many people deteriorate while everyone respected procedure more than urgency. "With respect, sir," she said, "the line does not matter if he loses the airway and circulation." The words hung there. Someone near the door inhaled sharply. Caldwell's face changed, not surprise, offense. "You do not speak to an attending physician like that in my unit." Crowe said nothing. That made it unbearable. Ava looked at Pike again, because the patient was the only way to stay steady. The old general's skin had gone from pale to something waxier gray, trying to emerge through the sedation and fluorescent light. His neck looked fuller on one side now, not dramatic, real. Her inner clock started counting without permission, not in minutes, in breaths. 1. Ventilator push, resistance. 2. Saturation 94. 3. Heart rate higher. She spoke without asking for permission this time. "This is not primary cardiac instability." Caldwell snapped enough, but Ava had already crossed the line in her own mind that mattered. The line between worrying quietly and acting. She stepped past the edge of the usual nursing position and moved to the central monitor where the pressure curves displayed more clearly. Her finger went to the waveform. "This has risen steadily since he came back from surgery." Caldwell turned red under the lights. "Step away from that monitor." Ava did not. "The oxygen drop is late compared to the pressure change. His left chest is not moving normally. You are making dangerous assumptions from partial data. I am trying to stop us from missing a mechanical collapse." The word collapse cut the room open. Even Caldwell flinched, not because he agreed, but because now the stakes had been named in language no one could soften. Crowe finally moved. Just one step, but everyone saw it. He left the foot of the bed and came along the side rail closer to the patient, closer to Ava, close enough now to test what she was saying for himself if he chose to. Caldwell seemed to register that movement a fraction too late. "Nathan," he said, controlled but tight, "we do not have evidence for that." Crowe's eyes remained on Pike, then on the vet, then on Ava. "How long since the pressure began rising?" he asked. The question was not addressed to Caldwell. Ava answered immediately. "From arrival to now, roughly 12 minutes of steady increase." Ellis cleared his throat, finding courage in the fact that Crowe had asked it all. "That is consistent with what I have on the vent." Crowe shifted his gaze to Ellis. "You documented it." "Yes, sir." Crowe looked back at the patient. Caldwell stepped in. "Transient post-operative changes can account for all of this. We need to avoid overreacting because a new nurse is interpreting normal recovery through a trauma lens." The sentence was polished, reasonable-sounding, and deadly in the way reasonable-sounding things often were when used to bury urgency. Ava did not even look at him. She looked at Pike's neck, then the chest, then the monitor. Another breath. The left side fell behind again. This time Crowe saw it too. Ava knew the exact second because his eyes narrowed not in confusion but in recalculation. He reached out and laid a flat hand high on Pike's upper chest, for one breath, then another. Not a long exam. Just enough contact to test tension through the body instead of through argument. Caldwell saw the gesture and went still. Crowe removed his hand. "What are his drains showing?" he asked. A resident answered too quickly, grateful for something concrete. Within expected range. Breath sounds. Nobody answered at first. Then Ava did, reduced on the left. Crowe turned his head. "You listened yourself?" "Yes, sir." "Recently?" "Within the last minute." Caldwell cut in. "This is still an incomplete exam in a crowded post-operative setting." Crowe did not acknowledge him. He kept his attention fixed on Ava in a way that made the whole room disappear. "What exactly do you think is happening?" The question landed like live current. Ava felt every heartbeat and then none. The world narrowed until there was only the patient, the CEO, the pressure curve, and the memory of a corporal gasping under canvas years ago while a young medic learned what hesitation costs. She answered from that place. "Air is building in the left chest." Her voice did not shake. likely early tension physiology. The oxygen saturation is lagging behind the mechanical problem. He is compensating now, but not well. Silence. No one in the room moved. Caldwell stared at her as if she had crossed from insubordination into fantasy. Ava went on because once the truth was spoken, halfway stopping only made it weaker. He has asymmetric chest rise, rising airway pressure, reduced breath sounds on the left, and increasing work of breathing despite the ventilator. If pressure keeps building, venous return drops and he crashes. Ellis looked at the vent again as if seeing it for the first time. Marisol had gone motionless beside the medication pump, eyes on Crowe. The resident nearest the door slowly lowered his tablet. Caldwell found his voice first. "That is a serious accusation to make in front of staff based on bedside impressions. We have protocol." Ava turned to him then, not defiant, just unwilling to step back from what she knew. "We have a patient who is changing faster than the protocol." Caldwell opened his mouth, but Crowe lifted one hand slightly and the room obeyed that gesture more completely than it had obeyed anything else all night. Crowe looked at Pike's neck again, then at the chest, then at the monitor. He stood in complete stillness for 3 seconds that seemed to stretch the air thin across the whole unit. Ava could hear a monitor from another room. Distant footsteps in the corridor. The low mechanical hiss of the ventilator forcing air against a chest that did not want it. Her hands had gone cold. This was the moment that mattered. Not whether she was embarrassed. Not whether Caldwell hated her. Not whether every resident in the unit would remember her as the nurse who overstepped in front of the CEO. Only whether Crowe chose to look at the same patient she was seeing. He had not answered yet. He had not dismissed her either. And because his silence no longer felt like indifference, Ava realized something that shifted the room in her mind. Crowe had not been standing there to supervise prestige. He had been measuring attention. She looked back at General Pike. His color had dulled further. The pressure curve climbed another increment. The left side of the chest barely lagged, but lagged all the same. Ava drew one steady breath and understood with total clarity that she could not let the room drift back into polite disagreement. Not now. Not with a body already declaring the truth more clearly than any title in it. When she spoke again, her voice came out firmer than before, stripped of apology, stripped of position. The voice of a medic who had finally decided hesitation was the more dangerous offense. "Sir, this patient needs immediate decompression assessment." For one suspended second, nobody in the room seemed to breathe. The ventilator kept cycling. The monitor kept pulsing. General Pike lay under the lights, sedated, motionless except for the wrongness in his chest and the numbers beginning to bend around it. Caldwell turned to Ava with a look that belonged to a man who had just watched a subordinate set fire to the chain of command in front of witnesses. "That is enough," he said. His voice came out low and hard, the kind of tone men used when they believed authority alone should finish the argument. Ava did not step back. Crowe kept his eyes on the patient. "Explain," he said. The word came flat, direct, and entirely for Ava. Caldwell stared at him. "Nathan." Crowe lifted one finger without looking away from the bed. It was not a dramatic gesture. It was not even sharp. Yet Caldwell stopped speaking mid-breath. Ava could hear her own heartbeat now. Not wild, not panicked, just present. She forced herself to stay inside the facts. Rising peak airway pressure. Reduced breath sounds on the left. Asymmetric chest rise. Increasing respiratory effort despite support. His oxygen saturation is lagging behind the mechanical change. He is still compensating, but not for much longer. Crowe looked at Ellis. Pressure trend. Ellis straightened. "From 22 to 34, sir. Progressive increase since arrival." Crowe shifted to the resident nearest the chart. Drain output. Still within expected range. Blood pressure. Holding with support. Rhythm. Sinus tachycardia. Caldwell stepped back into the space, trying to seize the room before it moved further away from him. "Which is exactly my point. This remains consistent with post-operative stress physiology. We do not needle a fresh sternotomy patient because a new nurse thinks the left side looks slow." Ava kept her eyes on Pike. Crowe finally turned and looked at Caldwell directly. "Do you hear yourself? The room went dead still. Caldwell held his ground. I hear myself protecting a patient from unnecessary intervention. Crowe moved closer to the bed. He bent once more over Pike's upper chest and watched the next 2 ventilator cycles in silence. His hand remained lightly braced against the sheet. His eyes tracked the rise under the fabric, the pull at the neck, the force in the machine curve. Then he straightened. Portable chest film now. One of the residents blinked. "Sir, the radiology team is tied up in thoracic recovery." Crowe did not raise his voice. "Then pull them from thoracic recovery." The resident moved. Caldwell took one controlled step forward. "We are losing time on the actual issue." Crowe turned to him. "No. We lost time because nobody in this room looked past the loudest number." A flush climbed Caldwell's neck. "That is unfair." Crowe's face did not change. "If you want fair, choose tennis. This is critical care." Nobody looked at Caldwell now. They looked at the patient, the ventilator, the line of Crowe's shoulders, the sudden rearrangement of gravity in the room. Ava felt it too. The moment had passed the point where she was simply speaking up. Her assessment now lived in the center of the room, not at the margins, and that was almost more dangerous. If the image came back clean, if the left lung looked clear, if this turned into nothing more than post-operative agitation and a difficult vent pattern, she would not be remembered as vigilant. She would be remembered as the nurse who forced the CEO to overrule a star surgeon in front of the unit. Crowe glanced at her once. "You stay right there," he said. Ava nodded. The minutes that followed stretched strangely. Everything moved fast and slow at the same time. Marisol cleared extra supplies from the bed rail without being asked. Ellis adjusted position at the ventilator, ready now for a problem he had not wanted to name aloud 10 minutes earlier. The residents hovered with the brittle alertness of men realizing the room had shifted into a different category of danger. Caldwell stood rigid at the bedside, face composed by force, eyes locked on the monitor as if enough certainty might bend the patient back toward his interpretation. General Pike took another assisted breath. His neck drew tight again. Ava listened once more at the left chest. Diminished. More obvious now that she knew what she was hearing for. She checked the right side again for comparison. Fuller. Cleaner. Crowe watched her do it. Not with approval, not yet. With scrutiny. "Breath sounds," he asked. "Still reduced on the left," Ava said. Caldwell said, "In this room, with all this equipment, auscultation is hardly definitive." Crowe answered without turning. "Neither is arrogance." The words hit hard enough that even the people outside the room seemed to go quiet behind the glass. The portable radiology team arrived in a rush of wheels and cables, one tech already apologizing to nobody in particular. Crowe stepped aside just enough to give them room. Caldwell moved too, though not willingly. The machine rolled into place beside the bed. Positioning happened fast, practiced tight. Pike remained sedated through it all, chest-bound by the dressing body still fighting under the surface while everyone arranged image plates and tubing around him. Ava stood at the left shoulder, one hand hovering near the ventilator tubing so it would not pull. Ellis supported the circuit. Marisol managed the lines with the compact competence of someone who had done difficult things in worse rooms. The tech looked at Crowe. "Ready. Take it." The plate flashed. Then the waiting began. In other units, the wait for a portable film might feel routine. In Bed 9, under Crowe's gaze and Caldwell's silence, it felt like standing in the open while someone decided whether incoming fire was real. The monitor read 93 now. Not crashing, still drifting. That made it worse. Ava found herself thinking not for the first time that the body often begged in increments before it screamed in alarms. The room had spent too long listening only for screams. The image loaded on the wall monitor. Lines resolved, bone, soft tissue, darker fields, shapes every trained eye in the room could read. Then the answer appeared in brutal black and white. The left side of Pike's chest showed a deep abnormal lucency. The lung margin was shoved inward. The mediastinum had begun to shift. Nobody spoke. Even the machine sounds seemed to pull back from the image for one stunned second. Ellis was the first to exhale. A small sound. Unsteady. One of the residents whispered, "Jesus." Marisol said nothing at all. Caldwell's face drained of color under the lights. Ava stared at the film and felt the violent quiet that came when dread turned out to be correct. No triumph. No relief yet. Just confirmation and the immediate knowledge that the clock had moved from suspicion to action. Crowe did not waste a second. Thoracostomy tray. Large chest tube. Now. A resident stumbled into motion. Another reached for the supply cart with hands that had gone clumsy. Ellis was already adjusting settings. Marisol moved to the medication cabinet and then back to the bedside in one smooth turn. Caldwell found his voice. "We can call thoracic and transfer him." Crowe looked at him as if he had misheard the English language. "Transfer him where?" Caldwell drew a breath. "To procedure." "He is in procedure." Crowe stripped off his suit jacket and handed it to nobody in particular. Marisol caught it before it hit the floor and folded it over a chair without ever taking her eyes off the bed. He rolled his sleeves one turn higher. Ava had seen competent men work under pressure before. She had seen performative men, too. Crowe belonged to neither category. The second the image confirmed the diagnosis, something in him narrowed and sharpened. The administrator vanished. The room was left with the surgeon, not hurried, not rattled, lethal in his focus. "Prep the field," he said. Marisol snapped on gloves. "Chlorhexidine. Analgesia. He is still sedated." Crowe glanced at the monitor. "Good. Let us keep him there." He moved to the left side of the bed and held out a gloved hand before anyone offered the instrument. A resident placed the wrong size tube into it. Crowe looked down once. "Did I ask for this?" The resident froze. "No, sir." Crowe gave it back without comment. Somehow that was worse than anger. Ava stepped in, opened the correct tray, and put the right tube into Crowe's hand. Their gloves touched for half a second. Crowe did not thank her. He did not need to. His eyes flicked to the tube, then to Ava, registering the correction in silence. Position. Ava and Ellis shifted Pike a fraction enough to expose the left side while protecting lines and dressing. Marisol secured the tubing. The residents made themselves useful now because there was no room left for vanity. Caldwell stood opposite the bed, still watching the man he had just argued with prepare to save the patient he himself had nearly lost. Ava looked once at Pike's face. Sedation had softened his features, but strain still lived in the jaw and the neck and the way the chest fought every breath. Crowe palpated landmarks with precise fingers. "Mid-axillary line," he said quietly, almost to himself. Marisol held the prep. The antiseptic went on in broad amber strokes across skin and dressing margin. The scent rose clean and sharp over plastic and sweat and machine heat. Crowe asked scalpel. Ava placed it in his hand before a resident could fumble. The incision was quick and exact. No flourish, no hesitation. Pike's pressure dipped. Ellis said, "He is dropping." Crowe did not look up. "He has been dropping." He advanced with controlled force, finding the pleural space by feel, not drama. The room leaned inward around him. Every person in it felt the same thing now. Not fear of Crowe, fear of being one breath too late. Then the trapped air released. The hiss came sharp and ugly, a violent exhalation from inside the chest. Loud enough to cut through the monitors. Long enough to raise the hair on Ava's arms. The whole room reacted to that sound. Ellis let out a breath he had been holding. One resident took half a step back. Caldwell closed his eyes for the briefest instant as if the reality of the error had become fully physical. Only once it announced itself through sound. Crowe inserted the chest tube with ruthless efficiency, guiding it home, securing position, attaching drainage. No wasted movement, no lecture, no victory in it. Only task sequence result. Connect. Ava did. The system engaged. More air escaped. The tube fogged, then cleared. The water seal flickered. Pike's chest rose on the next breath. This time, both sides moved closer together. The monitor responded as if it had finally decided to tell the truth. 93. 95, 97, 99. Ellis stared at the numbers. Pressure is coming down. Heart rate began to fall too, from frantic to merely fast, then steadily lower. Marisol checked the blood pressure and gave a small nod. He is stabilizing. The room exhaled as one organism. Ava did not realize until that moment that her shoulders had been rigid enough to hurt. She loosened her grip on the side rail and immediately felt the tremor in her hands that adrenaline had postponed. Crowe secured the tube, checked the system, and stripped off one glove. His face remained composed, but the force in the room had changed. The danger had not vanished. It had been turned, controlled, pushed back from the edge by minutes, and one decision no one wanted to hear until they were forced to hear it. Caldwell spoke into that silence as if he had to fill it or drown in it. Good catch on the image. No one answered him. He tried again, this time to Crowe. The presentation was atypical. Crowe lifted his head slowly. It was early. Caldwell opened his mouth, then stopped. Crowe looked from the monitor to the film still glowing on the wall, and then to Ava, standing at the left side of the bed with her stethoscope around her neck and sweat cooling at her spine. The presentation was early, Crowe said again. That is why it required eyes instead of excuses. Nobody in the room moved. Ava looked down at Pike's chest. It rose more evenly now. The neck strain had eased. Some of the gray had left his face, not all at once, but enough to make the difference visible. She felt a wave of relief hit so hard it almost made her lightheaded. She had been right, and because she had insisted the patient had a future beyond this room. The thought brought no satisfaction, only delayed fear. Because now came the other part, the part after the save, the part where people remembered who had challenged whom, who had been humiliated, who had been right in public, and who held the power to make tomorrow unbearable. Crowe peeled off the second glove and handed both to a waiting aide. Repeat imaging after placement. Full reassessment. Update blood gas. Watch him closely for re-expansion and hemodynamic response. The unit responded at once, glad for instructions that belonged to a world after the emergency. Ellis checked vent synchrony again. The residents dispersed into tasks with grateful urgency. Marisol began documenting the procedure with quick, exact shorthand. The tech moved to reposition for a follow-up image. Ava remained where she was for one breath longer than she needed to, staring at General Pike, now looking less like a man slipping away and more like a man dragged back by force from the edge of something dark. Caldwell stood across from her. For the first time since she had met him, he did not seem polished. He seemed exposed. He avoided her eyes and looked instead at the drainage system, at the monitor, at the dressing, anywhere but at the quiet nurse who had named the diagnosis before he did. A resident near the wall shifted awkwardly, clearly unsure whether to stay invisible or become helpful in a new direction. Another busied himself with charting at impossible speed. Outside the room, through the glass staff from the central station, pretended not to stare and failed. News traveled quickly in hospitals. News like this did not travel. It detonated. The rookie nurse had challenged Caldwell in front of Crowe. The rookie nurse had been right. Crowe had taken her side. Those facts were already moving through the unit in silent fragments before anyone spoke them aloud. Crowe reached for a towel, wiped his hands, and finally looked at Ava directly. He did not smile. He did not soften. But whatever he saw in her now was not what he had seen when he entered the room. "What was the first thing you noticed?" he asked before the saturation changed. The room stilled again. Ava answered because there was no reason not to now. "The trend line," she said. Not the number, the drift. Then the left chest lag, then the pressure curve. Crowe held her gaze another second. "You trusted the trend before the alarm?" "Yes, sir." "Why?" The question was simple. The answer was not. Ava glanced once at Pike, then back to Crowe. Because bodies fail before monitors admit it. Something almost imperceptible shifted in Crowe's face. Not emotion exactly. Recognition. Caldwell spoke, then, unable or unwilling to let the exchange continue without him. With respect, one successful observation does not justify dismantling clinical hierarchy in an acute case. Crowe turned. There were many ways a powerful man could destroy another man in front of witnesses. Some shouted, some humiliated, some recited the facts with surgical calm and let the room do the rest. Crowe chose the third. A 73-year-old post-operative patient developed early tension physiology in front of a full critical care team, he said. A new nurse saw the trend. Respiratory saw the pressure change. Nobody in this room acted until she forced the issue. Not because the evidence was absent, because the hierarchy was louder than the patient. No one looked at Caldwell now. Crowe continued, "You call that hierarchy. I call it drift. And drift kills." A resident standing at the charting station lowered his eyes, as if the reprimand had landed on him too. In a way it had. It had landed on the whole room. Caldwell's face tightened. "I made a judgment." Crowe answered immediately, and she made an assessment. Hers kept him alive. The words stayed in the air after he said them. Ava felt every pair of eyes in the room come to her and then away again. She wanted none of it. Not the spotlight, not the vindication, not the strange electric silence that followed public correction at that level. She wanted the room back the way good rooms worked, where the patient mattered more than the people around the bed. But rooms never returned to what they had been after moments like this. They became something else. Marisol was the first person to move as if the world had resumed normal speed. "Tube secured," she said. "Repeat film in progress." Crowe nodded once. "Good." He stepped away from the bed at last. The shift in physical space was immediate. The force that had gathered around the procedure loosened. People began to breathe like themselves again. One of the residents asked Ellis a question in a lower voice than usual. The radiology tech adjusted the machine with hands steadier now that the worst had passed. Outside the room, the central station resumed its careful impersonation of business as usual. Ava looked down at her chart and realized she had not written in several minutes. She tried to steady her pen. Her first line came out clean. Her second almost did. Then the tremor returned. Not dramatic, just enough to make the letters smaller. Adrenaline after the fact. She knew it well. The delayed shake. The body's private accounting once the work was done. Marisol noticed and moved closer under the cover of checking the pump. "You did fine," she said under her breath. Ava kept her eyes on the page. He almost coded. He did not. Ava swallowed, not because of me alone. Marisol gave the faintest snort. "No one saves anyone alone. That is not the point." Before Ava could answer, the follow-up image appeared. Improved expansion. Mediastinal shift reduced. Tube in position. Ellis smiled despite himself. "That looks better?" Crowe glanced at the film and gave one curt nod. "It does." He turned back to the room. "Document accurately. Every timeline, every pressure change, every intervention. I do not want this cleaned up for anyone's reputation." That instruction landed heavily. Hospitals were full of people who charted facts. They were also full of people who understood which facts tended to get softened when prestige was on the line. Crowe had just closed that door before anyone reached for it. Caldwell heard the implication clearly. "I have no interest in rewriting the record." Crowe looked at him without blinking. Good. For the first time all evening, Caldwell seemed to understand that no answer available to him would improve his position. He gave a stiff nod and turned his attention back to the patient. The movement was small, but Ava read it for what it was. Not surrender exactly. Something more dangerous to a proud man. Constraint. General Pike's heart rate settled further. The old general looked older now that the immediate strain had lifted, but also more alive. Less trapped inside a body under pressure. A flush had returned to his cheeks. The left side of the chest moved with the right more cleanly each cycle. The room no longer felt like a battlefield under bombardment. It felt like the scarred ground just after impact when everybody was still taking stock of who had survived and what had been exposed. A nurse from the station knocked softly and entered with updated labs. She paused half a second too long, clearly aware she had walked into the aftermath of something enormous. Marisol took the printout from her and sent her on with a glance. Crowe checked his watch. Then he looked at Ava again. "What is your full name?" The question startled her more than the procedure had. "Ava Bennett, sir." "How long have you been on this unit?" 93 days. One of the residents blinked, as if the number made the scene even harder to absorb. Crowe said nothing for a moment. Then to the whole room, 93 days. No emphasis. No speech. Just the fact itself set down like evidence. Ava kept her face neutral and her eyes on the chart. Anything else would have felt dangerous. Caldwell adjusted the line at the bedside with meticulous care. He still did not look at her. Crowe finally turned toward the door. Then he stopped and looked back once more at General Pike, at the tube at the monitor now reading numbers everyone preferred, and at the people who had nearly lost the patient while standing inches away from him. "Nurse Bennett," he said. Ava looked up. "With me. When you are done stabilizing this room." There was no room in his tone for uncertainty, and no way to tell from his face whether this was reward reprimand or something less predictable. "Yes, sir," Ava said. Crowe left the room. The doors sighed shut behind him. For a moment, no one spoke. Then the unit sound returned all at once. A printer at the station. Footsteps in the hall. A monitor alarm 2 rooms over. Ellis asking quietly for updated vent settings. Marisol dictating the procedure note. One resident rushing to place the repeat orders he should have placed minutes earlier. Ava looked at General Pike one more time and listened to the tube system hiss softly with each recovered breath. Across the bed, Caldwell finally raised his eyes to hers. He did not apologize. Not yet. But whatever had lived in his expression before was gone. In its place was something far less comfortable. Recognition. Ava broke eye contact first and returned to her chart. Her handwriting steadied line by line. Time of deterioration. Pressure trend. Clinical observations. Escalation. Imaging. Emergent thoracostomy. Response. Facts. Nothing more. Nothing less. When she set the pen down, the tremor in her hands had eased. The room was stable again. Not safe exactly. Not settled. But stable enough to leave for 60 seconds. Marisol touched her elbow lightly. "Go." Ava nodded. She stepped away from bed 9 through the same space where she had just challenged the hierarchy of the unit and into the corridor where the lights looked brighter than before. At the far end of the hall, near the glass wall overlooking the dark San Antonio skyline, Nathan Crowe was waiting for her. At the far end of the hall, near the glass wall overlooking the dark San Antonio skyline, Nathan Crowe was waiting for her. The city behind him looked distant and unreal through the glass. Red aircraft lights blinked in the warm Texas night. Traffic moved below in thin threads of white and amber. Inside the 12th floor corridor, everything was bright enough to feel merciless. White walls, white light, white tile. No place for a person to hide inside her own expression. Ava walked toward him with the strange, weightless feeling that often came after adrenaline. Her body was no longer in the emergency, but it had not quite accepted that fact yet. She was aware of everything at once. The cool air against the sweat drying at the back of her neck. The pulse in her wrists. The pressure mark her stethoscope had left against her collarbone. The soft click of her shoes on the polished floor. Crowe did not speak until she stopped a few feet away. "How old are you, Nurse Bennett?" 28, sir." He nodded once, as if fitting the number into something he was already measuring. "You do not sound like somebody who has only been on a civilian unit for 93 days. Ava kept her hands loose at her sides. "I was Army Reserve before nursing school." Crowe's gaze sharpened almost imperceptibly. "Doing what?" "Combat medic." He was silent for a moment. Not surprised exactly, recalculating. "How long?" 6 years. "Deployed." "Yes, sir." He studied her face in the kind of stillness that forced people to fill it. Ava did not. She had learned long ago that powerful men often mistook unnecessary speech for weakness and silence for discipline. Crowe seemed like the type who respected both only when they were intentional. Where did you learn to spot tension that early? He asked. Ava let out a slow breath. Not from one place. Crowe waited. She looked past him for a second, not at the city, but at the reflection of the ICU doors in the glass. Her own face looked steadier there than it felt. In field medicine, she said, if you waited for a situation to look dramatic, you were usually already late. Then, in trauma rotation in Chicago, the nurses there drilled the same thing into us. Look at the trend before the crisis. Watch the work of breathing. Watch the skin. Watch the chest. Watch what the body does when the monitor still thinks there is time. Crowe said nothing. Ava went on because the words had already started moving. I saw a casualty once overseas with a chest injury that did not look catastrophic at first. Vitals were not terrible. He was talking. Everybody wanted to keep moving because louder problems were nearby. But one side of his chest moved wrong. Pressure built slowly. He almost died because the room believed the numbers more than the pattern. She stopped there. Crowe's expression did not soften, but something in it grew less remote. Most hospitals, he said, reward speed polish and confidence. Those are useful traits until people start mistaking them for judgment. Ava held his gaze. Sir, he turned his head and looked through the glass into bed 9. From where they stood, they could see only part of the room. The monitor glow. Marisol at the pump. Ellis at the ventilator. Caldwell's back turned toward the bed. I have been seeing the same problem for months, Crowe said. Not this diagnosis, this structure. Ava stayed quiet. Near misses. Delayed escalations. Younger staff noticing something, then swallowing it because they do not want to be wrong in front of the right person. Senior physicians getting so used to command that they stop recognizing information when it arrives in a lower voice. He looked back at her. You think tonight was the first time that has happened in this building? It was not phrased as a question. Ava chose her answer carefully. No, sir. Do you think it was the worst? I do not know. Crowe nodded once. Honest. He shifted his weight slightly and folded his arms not defensively, just settling deeper into the conversation. Caldwell is one of the best surgeons in the country, he said. On paper, in the operating room and outcomes that can be graphed and presented to donors. But brilliance has a way of collecting insulation. People stop challenging it because they enjoy standing near it. Then one day the insulation becomes blindness, inside bed 9. Marisol adjusted a line and leaned over the chart. Ellis glanced up at the wall monitor and then down again. The room looked orderly now, controlled. It was almost impossible to tell by looking at it that 10 minutes earlier it had been inches from catastrophe. Crowe's voice stayed level. I did not come to 12 tonight because I was worried about a donor. I came because this unit has been drifting. Ava felt that word again. Drift. He had used it in the room, and it had landed harder than shouting would have. I review every serious event, he said. Every mortality. Every escalation delay. Every complaint everyone assumes only legal reads. I have had the numbers for months. They pointed to the same pattern. Good medicine on paper, dangerous silence in practice. He let that settle. I suspected the hierarchy in this unit had become decorative in public and corrosive in private. Tonight gave me proof I could not ignore. Ava did not know what to do with that. She had spent the last hour trying to keep a man alive. The idea that she had also become evidence in a war above her pay grade felt unsettling in a way she could not yet name. Crowe seemed to read some of that in her face. You were not used, he said. Do not confuse what I am telling you with that. I did not orchestrate a patient deterioration to test the staff. Ava almost smiled despite herself. I did not assume you had, sir. His mouth moved a fraction, not a smile. A recognition of dry humor where he had not expected it. Good. The hallway stayed quiet around them. Somewhere far below, a helicopter passed through the night with a faint low thrum that never fully reached the glass. A nurse pushed a linen cart at the far end of the corridor and then disappeared through another set of doors. The hospital kept moving unaware or unwilling to show awareness that one of its power lines had just shifted. Crowe looked at Ava again. When Caldwell shut you down the first time, why did you speak again? The answer came faster than she expected. Because he was still getting worse. That is not what I asked. Ava hesitated. Crowe waited her out. She looked back through the glass at General Pike. Because I knew what staying quiet would feel like if I turned out to be right. Crowe's eyes stayed on her. And what would that feel like? She could have given him a polished answer. Duty. Responsibility. Professional obligation. Words that fit into mission statements and leadership lectures. Instead, she heard herself tell the truth. Like cowardice. Crowe absorbed that without visible reaction. Then he nodded. Yes, he said, that is usually what it is. The simplicity of the agreement hit Ava harder than any praise could have. People often cushioned fear with kinder language. Hesitation. Uncertainty. Chain of command. Crowe had no use for cushions. He glanced at his watch, then toward the ICU doors. Tonight changes some things. Ava felt her stomach tighten at that. In hospitals, change rarely arrived as cleanly as the word suggested. Change could mean meetings, resentment, whispered reputational damage, and your name spoken differently after rounds. Crowe seemed to know exactly which kind of change she was expecting. You are not in trouble, he said. Ava exhaled once through her nose. That had crossed my mind. For about 3 seconds, I imagine. Closer to 30, that fractional almost smile appeared again and vanished. I am implementing a direct escalation protocol for this unit, he said. Night shift first. Any nurse resident or respiratory therapist who sees acute deterioration and cannot get traction through the usual line may escalate without waiting for attending approval during the first response window. Ava looked at him carefully. Tonight. Yes, sir. Not after review. Tonight. He said it like a decision already signed. Ava could picture the reaction before it happened. Residents trying to look principled while privately terrified. Attendings calling it procedural overreach. Senior staff dividing into camps. Administrators reaching for softer language. The old reflexes in the building would not vanish because Crowe had named them. He kept speaking. I am not interested in performative flattening of hierarchy. Somebody still has to own the final call. That is not the problem. The problem is when lower voices stop being heard early enough to inform the call at all. Ava nodded slowly. Crowe's gaze narrowed on her face. You understand that distinction? Yes, sir. Good. He unfolded his arms. I want you in the first meeting. For the first time since leaving bed 9, Ava lost the ability to mask her surprise completely. Sir, you heard me. I am 93 days into orientation plus survival. You are 93 days into this building, not into judgment. Ava felt heat return to her face. There are nurses here with 20 years on this unit, and some of them should also be in the meeting, Crowe said. This is not a coronation, it is a repair. He spoke the last word with enough weight that she understood he meant the whole structure, not one policy. Still, the idea of being pulled into that room felt unreal. I do not know hospital politics, she said. Excellent, Crowe replied. Then you have a chance not to speak them by accident. Before she could answer, the ICU doors opened, and Marisol stepped into the hall. Her eyes went briefly from Crowe to Ava, and then back. General Pike is stable for the moment. Follow-up film looks good. Crowe nodded. Thank you. Marisol did not move right away. Ava knew that look. The charge nurse wanted to stay exactly long enough to establish that the patient was covered, and the unit remained functional, but not so long that she appeared to intrude on whatever conversation was unfolding. Crowe solved it for her. Trent, conference room B at 0630. You respiratory lead night supervisor Risk and Dr. Caldwell. Marisol's brows lifted 1 degree, yes sir. And Nurse Bennett. Now Marisol looked at Ava fully, not surprised that she was being included. Surprised by how openly. Understood, she said. She went back into the unit. Ava looked at Crowe. Sir, with respect, that is going to make people furious. Crowe's eyes cooled. People become furious when comfort is interrupted. I did not take this job to preserve comfort. He turned toward the doors, then stopped. One more thing. Ava waited. Do not mistake tonight for an invitation to become theatrical. Speak when you have something. Stay quiet when you do not. The people who get promoted by one correct crisis often become intolerable. The warning was so blunt that Ava almost laughed, but there was no mockery in his tone. It was practical, almost clinical. I understand. Good. He started back toward bed 9. Ava moved with him half a step behind until they reached the doors. There, Crowe paused again and looked at her badge as if confirming the name once more. Bennett. Yes, sir. When you write your note, do not make yourself look brave. Ava frowned slightly. No, sir. Make yourself accurate. Then he went inside. Ava remained in the hall for 2 breaths after the doors closed. The conversation had not felt long yet. Something in her sense of the building had changed in it. The floors were the same. The lights were the same. The 12th floor smelled the same as it had 20 minutes earlier. But the shape of authority in her mind no longer matched what she had believed when the shift began. She went back into bed 9. The room had settled into the dense, practical rhythm that follows any successful rescue. The emergency energy had drained away and left work behind. Marisol was reconciling medications and documenting the procedural timeline. Ellis had the ventilator synchronized more cleanly now and looked a decade younger with the immediate crisis off his face. One resident was entering orders with the concentration of someone trying to rewrite himself through efficiency. Another was reviewing the new image on the wall monitor. The third stood near the foot of the bed, pretending to read the chart while clearly listening to everything. Caldwell remained at the bedside, one hand lightly touching the rail shoulder's square expression composed by force. He looked like a man standing in his own office after a fire, trying to behave as if the walls had always been blackened. Ava stepped to the station outside the room and opened the chart. Her note took shape line by line. She did exactly what Crowe had told her to do. She made herself accurate. Time of initial trend observed. Changes in saturation. Increasing peak airway pressure. Asymmetric chest rise. Decreased left breath sounds. Escalation to attending. Persistent concern. Escalation in presence of CEO. Portable imaging. Confirmed left tension physiology. Emergent decompression and chest tube placement. Immediate clinical improvement. She kept the prose clean and plain. No heroics, no defensiveness, no adjectives that belonged in memory instead of record. By the time she finished, the unit had started breathing around her again. Not normally, a little too carefully. Staff drifted by the station and found reasons to look into bed 9 or at Ava and then away. The unit secretary, Beth, set fresh labels by the printer and said without looking up, "You need coffee." Ava blinked at her. Is that a question? It is a statement from someone who can see your face. Ava rubbed her brow with 2 fingers later. Beth nodded like a woman who had already expected that answer. They are all talking about it. About what? Beth finally looked up. About everything. Ava glanced through the glass. That sounds exhausting. Hospital gossip usually is. Marisol exited bed 9 carrying a stack of printouts. She set them beside the terminal and looked at Ava's note. Good, she said after scanning the first paragraph. Too much. Not enough if legal gets hungry, but enough for tonight. Ava leaned back slightly in the chair. Crowe put me in the 6:30 meeting. Marisol's eyes lifted. I know. You know because he told you. I know because when men like Crowe make a decision, it shows up on 3 floors before the air pressure changes. Ava let out a breath that almost counted as a laugh. Marisol's tone lowered. You did not just save Pike. You put your finger on the thing this place has been pretending not to have. Ava looked at the chart again. That does not feel comforting. It should not. Marisol picked up the printouts again, then paused. For what it is worth, there were nurses in this unit who saw parts of what you saw and did not push because Caldwell was in the room. Do not spend tonight imagining everyone else was blind. Most people were scared. The statement sat heavily. Ava turned it over in her mind. It felt true. It also felt worse than simple incompetence. Blindness could be fixed with training. Fear was harder. Fear learned the architecture of a place and settled into the walls. Before she could respond, bed 9's door opened and Caldwell stepped out. The whole station felt him arrive without anyone acknowledging it. He stood a few feet away from Ava, not close enough to seem intimate, not far enough to pretend the encounter was accidental. Up close, under the unforgiving light of the station, he looked older than he had in the room. Not physically aged in an hour, but stripped. The effortless finish had gone out of him. "Marisol," he said quietly. She looked at him. "Doctor, could I have a word with Nurse Bennett?" Marisol glanced once at Ava. The glance asked a question and left the answer to her. Ava stood. "It is fine." Marisol nodded and stepped away toward Beth's desk, close enough to hear if the tone changed far enough to give the conversation air. Caldwell waited until the station noise covered them before speaking again. "I owe you an apology." The words were not dramatic. They sounded expensive. Ava did not answer right away. Caldwell looked toward the glass wall of bed 9 toward Pike, resting under the monitors. "I dismissed your observation because it came from you," he said. "Not because the data were absent. That is the truth of it." Ava stood very still. "I told myself I was protecting the patient from distraction," he went on. "What I was actually protecting was my own certainty." He said it without self-pity. That made it more convincing than any polished remorse could have. Ava looked at him for a long second. "You were focused on the wrong problem." "Yes. You also told me to stay out of the way." Caldwell's jaw tightened once. Yes. The admission seemed to cost him something fresh. Ava could have punished him then. The room, the hour, and the facts all gave her permission. But punishment in hospitals had a way of becoming theater, and theater had almost killed Pike. "We were looking at the same patient," she said. "You just stopped hearing part of the room." Caldwell met her eyes for the first time since the chest tube went in. "That may be the most generous version of what happened. I am not trying to be generous." "Then what are you trying to be?" Ava thought about that. "Useful." Something in his expression shifted. Not comfort. Recognition again, but of a different sort. He gave a small nod. "You were." He drew a breath and let it out slowly. "For what it is worth, Crowe has been looking for a fault line in this unit." "I knew that. I did not think it would open under me." Ava said nothing. Caldwell glanced toward the conference room B at the end of the corridor and then back to her. "He will use tonight to change more than a protocol. He already said he would." "I know." Caldwell's voice had gone quieter. "And he is not wrong." That might have been the most startling sentence of the night if the night had not already contained so many. He looked at her badge. "Nurse Bennett." "Ava is fine." He nodded once. "Ava." He seemed about to say something more, then changed his mind. "General Pike is alive because you stayed with your assessment under pressure. That matters more than my pride." With that, he stepped back and returned to bed 9. Ava watched him through the glass for a moment after he went in. Caldwell moved differently now. Not broken, not transformed, but less encased in himself, as if the room had taken a piece of his certainty and left the edges exposed. Marisol reappeared beside her. "Well," Ava sat back down. He apologized. Marisol gave a low whistle. "Document that too if you can find a billing code." Beth snorted from behind the desk and pretended she had not. The rest of the night wore on in the way hard nights always did. Not with rest, but with less immediate danger. Pike remained stable. Labs improved. The chest tube held. Ventilator pressures settled. The residents became almost over-attentive. Ellis checked his connections twice, and then once more because trust in the room had become a more active thing. Marisol rotated staffing to keep fresh eyes on bed 9. Beth quietly prevented 3 unnecessary calls from reaching the bedside. Somewhere after 2 in the morning, Ava finally accepted the coffee Beth had been right about. By 5:30, the hospital had entered that gray hour before dawn, when people either sharpen or unravel. The city outside the windows had faded from black to deep blue. The first housekeeping cart rattled down the far hall. Day shift nurses began arriving with damp-haired travel mugs and faces not yet arranged for whatever the building planned to do to them. Conference Room B sat off the administrative corridor, all glass on one side and dark wood on the other, the kind of room designed to make difficult decisions look civilized. At 6:28, Ava stood outside the door in fresh gloves of self-control coffee gone cold in her hand and watched staff gather through the glass. Marisol, the respiratory lead. Night supervisor, a woman from risk management with a stack of printed charts. Caldwell in a fresh coat, though not a fresher face. Two administrators Ava recognized only by sight. Then Crowe, right on time, carrying no folder at all. When he entered the room, changed shape immediately. Ava went in last and took the empty seat nearest the end of the table. Nobody commented on her being there. That silence itself said enough. Crowe did not waste time. At 1847 last night, he began a post-operative cardiac patient in bed 9, developed early tension physiology that was recognized first by the lowest-ranking bedside clinician in the room. His voice was calm, almost neutral. The neutrality made every word heavier. No one here needs a lecture on the medical event. The event is clear. What concerns me is the response structure that nearly let it progress. He looked around the table, letting the statement land on each person separately. By the time a patient becomes obvious to everyone, somebody has already failed to listen earlier. The woman from Risk slid printed timelines across the table. One copy stopped in front of Ava. Her own note was highlighted in yellow beside Ellis's vent documentation and the radiology timestamp. Clean. Unsoftened. Crowe had meant what he said. He placed one hand flat on the table. Effective immediately. Liberty Cross will implement night signal authority in the cardiac ICU. Any nurse, respiratory therapist, or resident who identifies acute deterioration and cannot get traction through the usual attending line. In the first response window, will have direct escalation access to the covering supervisor and to my on-call chain if necessary. One administrator shifted. Nathan, that will create reporting chaos if everyone starts bypassing standard hierarchy. Crowe looked at him once. No, it will create evidence. The administrator went quiet. Crowe continued. This is not a popularity exercise. It is not a referendum on attending authority. It is a safeguard against delayed recognition caused by rank pressure. He turned to Caldwell. You will brief your service by noon. Caldwell nodded. I will. The woman from Risk asked, and review thresholds. Strict, Crowe said. This protocol is not for personality conflict. It is for acute clinical concern with documented trend bedside evidence or unresolved deterioration. He looked toward Ava. Nurse Bennett identified the pattern correctly because she observed the patient before she deferred to the room. That should not be rare. It should be normal. Ava felt every eye at the table move to her and then away again. Crowe did not linger there. Trent, you will help build bedside criteria for nursing escalation. Respiratory will do the same for ventilator pressure and support changes. Risk will monitor every use of the protocol for 3 months. I want signal, not theater. The meeting moved on from there into language sharper and drier than the drama of the night had prepared anyone for. Time thresholds. Reporting tree. Documentation standards. Event review. Staff education. Who gets called first? Who is allowed to override whom and on what basis? The architecture of culture translated into policy before the building could talk itself out of the memory. Ava said little. When Crowe asked what had made her escalate past Caldwell, she answered plainly. Progressive pressure change. Asymmetric chest movement. Delayed oxygen drift. Reduced left breath sounds. Incompatibility between the patient's body and the room's explanation. She spoke once, maybe twice more, only when asked. Crowe seemed satisfied by that. By the end of the meeting, daylight had begun to reach the high windows. San Antonio turned gold at the edges. Inside the conference room, coffee had gone stale. Tempers had cooled into resolve, and a policy that did not exist yesterday now sat in draft form across the table. Crowe stood first. "This does not fix culture by itself," he said. "But it tells the culture what the hospital is willing to protect." He looked once toward Ava, once toward Caldwell, then toward the rest of the table. "Get some sleep, then start." The meeting broke. Chairs slid back. Papers gathered. People left in pairs or alone, each carrying a different version of what the night had meant. Ava remained seated for half a second after the others stood, fingertips resting on the edge of the highlighted timeline. The paper showed facts, times, observations, decisions. None of it reflected the actual sensation of standing in bed 9 while a room full of status leaned the wrong way. None of it captured the cost of speaking before anyone thanked you for it. But that was the nature of records. They held the bones. Memory carried the blood. Marisol touched her shoulder lightly as she passed. "You coming?" Ava rose and followed her into the brightening corridor. Outside the hospital was waking up to a new shift. Inside, the old rules no longer fit quite as cleanly as they had the night before. By 7:15, day shift had fully arrived, and the cardiac ICU was performing its usual trick of looking normal again. Scrubs changed color. Fresh faces stepped into tired ones. Reports were given in low voices over glowing screens. Medication times rolled forward. A family member at bed 6 asked for an update on a lab result and received one in the same calm tone nurses used on every floor in every hospital, the tone that made medicine sound almost manageable even when it was not. A housekeeping cart moved past the glass doors with folded towels stacked in neat white squares. Somewhere in the building, breakfast trays were being loaded. Somewhere else, an elevator opened on a donor floor, where the coffee was better, and nobody smelled the inside of an ICU after a hard night. Ava stayed through handoff with the precise numbness of someone whose body had not yet decided whether to collapse or keep moving. She gave Pike's report to the day nurse in clean-clipped detail. Post-operative triple bypass, early left tension physiology, emergent decompression, chest tube placed by Crowe, stable overnight, pressures improved. Repeat imaging acceptable. Watch for re-expansion output pain, hemodynamics rhythm changes. The words came out flat because that was the only way to get them out at all. The day nurse, a sharp woman named Dana, who had been on the unit almost 15 years, listened without interrupting. She glanced once through the glass at Pike, then back to Ava. You saw it before everybody else. It was not admiration, it was assessment. Ava capped her pen. I saw enough to keep pushing. Dana held her gaze for a second, then gave a small nod. That is usually the hard part. No more than that, no fuss, no speech. Somehow, that steadied Ava more than any dramatic praise could have. At 7:40, she finally stepped off the unit. The elevator ride down felt longer than usual. She stood alone in the mirrored car badge, still clipped to her scrubs hair, escaping its tie eyes shadowed from the shift. The mirrored walls reflected her from 3 angles, and none of them looked like the version of her other people would carry after tonight. In the reflection, she just looked tired. Young, slightly wrung out, a nurse at the end of a brutal shift trying not to think too hard until she got home. When the doors opened onto the employee garage level, warm Texas air reached into the concrete bay and met the hospital chill still clinging to her skin. Her car sat where she had left it before dawn the day before, ordinary and dusty and absurdly disconnected from the fact that a few floors above a 4-star general was alive because she had refused to yield a point. She got inside, shut the door, and only then allowed herself to stop holding her face together. Her hands shook first, not elegantly. Not one cinematic tear rolling down one cheek. It was the old release, the one she knew from field training and trauma rotations and every other moment when action ended before the body believed it had survived the ending. Her fingers trembled against the steering wheel. Her shoulders loosened all at once and then started to ache. Her breathing went uneven. For a few seconds she sat there with her forehead against the heel of her hand, eyes closed, letting the adrenaline burn itself out without argument. When she finally looked up, her phone screen was lit with 2 missed texts from her younger brother in Austin, asking if she wanted to come by for barbecue that weekend, and one from an old Army Reserve friend who had somehow developed the habit of checking in after hard shifts, as if distance could still detect stress through concrete. "You alive?" Ava stared at the message and typed back, "Yeah." Then, after a second, "Long night." The reply came almost immediately. "The bad ones always are." She let out a tired breath that almost became a laugh, started the car, and drove home through a city already fully awake. Sleep came in pieces. A dark room. A fan turning overhead. Half-dreams built from fluorescent light and chest tube trays and the sound-trapped air made when it escaped a body under pressure. She woke once around noon, thirsty and disoriented, and saw the hospital app on her phone loaded with internal messages she had not yet opened. Then she slept again until late afternoon, when the sky outside her apartment had turned gold and her nerves had settled enough to let her be hungry. By the time she returned for the next shift, the story had outrun her. She felt it before anyone said anything. Conversations paused half a beat when she passed the central station. Residents who had never looked directly at her before now did. Beth at the desk slid a printed staffing sheet toward her and said with studied casualness, "You are famous." Ava dropped her bag into the locker. "That sounds terrible." Beth smiled into her keyboard. "It usually is." The unit itself looked the same. Same locked glass doors. Same banks of monitors. Same chilled, disciplined air. But its posture had changed. People on night shift spoke a little lower around her, not out of pity. Not exactly out of reverence, but with the careful attention units develop after a public rupture in authority. Nothing material had changed yet. The policy was still being typed into existence somewhere upstairs. The same attending still carried the same privileges. The same residents still wore the same badges. But the room remembered. That was enough to alter its breathing. Marisol met her near the med-room. "You sleep. Some. That will have to count." Marisol handed her an updated assignment sheet. "You have bed 4 and 6. Pike is still in 9, but transfers likely tomorrow if he behaves." Ava scanned the sheet. "How is he?" "Alert now, irritable," which is promising. Ava tucked the paper under her clipboard. "Anyone yell at you in the staff meeting?" Marisol gave a dry look. Several people tried to sound concerned about Process. Crowe asked whether Process would prefer a dead donor or a bruised ego. That ended the discussion. Ava almost smiled. Marisol's voice lowered. "Night signal goes live tonight." Ava looked up. Already. He was not kidding. A laminated sheet had been posted beside the central station while she was sleeping. Red font, clear thresholds, escalation route, documentation requirements. No flourish. No vague, inspirational language. Just criteria and names and numbers. It looked military in the way good emergency procedures often did, stripped down to action and consequence. Beth tapped the corner of the sheet with a pen. 3 people have already called it the Bennett Rule. Ava winced. "Please tell me that dies." Beth's mouth twitched. "No." The first few hours passed without drama. That was how units worked. Even after a night that seemed large enough to bend the whole building, medication still had to be hung. Dressings still had to be checked. Family members still needed plain language and warm blankets and clear eyes from the people taking care of them. Bed 4 belonged to a man 2 days after valve repair who wanted to know why every deep breath felt like betrayal. Bed 6 housed an exhausted school principal waiting on rhythm stabilization while her wife sat beside the bed, grading papers in red pen between updates. Ava moved through assessments, charting, and medication passes with the quiet automatic efficiency that came easiest after hard shifts. Work steadied her better than thought. At 21:15, she was adjusting an infusion in Bed 6 when a shadow paused outside the doorway. Caldwell. He wore a fresh coat and a face that had recovered some of its usual composure but not all of it. The old, effortless finish remained interrupted. Ava finished programming the pump before stepping out into the hall. Dr. Ava. The use of her first name still sounded unfamiliar from him. He glanced into bed 6 and then back at her. "How is Pike?" "Better. Awake according to report." Caldwell nodded once. They stood in the corridor with the noise of the unit moving around them. A monitor alarm sounded from farther down got silenced and did not return. Ellis passed carrying tubing and gave both of them the brief neutral nod of a man who preferred respiratory crises to interpersonal ones. Caldwell said, "I am briefing the fellows differently tonight." Ava waited. He looked toward the laminated escalation sheet posted by the station. "I told them if a bedside clinician presents a trend they cannot explain away in one sentence, they stop and look again before speaking." Ava studied his face. There was no grand apology in it. No request for absolution. Just the rough outline of a man trying not to make the same mistake twice in 48 hours. "That seems reasonable," she said. He gave a short breath through his nose. It felt humiliating to say it. "I assumed it might." That actually pulled the smallest real smile from him gone almost before it formed. "Crowe asked me a question this afternoon," Caldwell said. "He asked whether I wanted my service to be feared or useful. I disliked the question because it was uncomfortably efficient." Ava leaned lightly against the wall, more tired than she wanted to admit. "And your answer?" "I told him those should not be mutually exclusive." Ava looked toward the patient room, then back. He probably hated that. He did. Caldwell paused, but he did not disagree. A chart was tucked under his arm. He shifted it to his other hand. "I also wanted you to know I corrected the procedure note addendum myself. Your escalation was documented accurately." Ava nodded. "Thank you." He hesitated, then said, "That was not a courtesy. It was the record." The distinction mattered. She let it sit between them without softening it. "Good," she said. Caldwell gave one brief nod and moved on down the corridor, coat swaying lightly behind him. Not redeemed, not ruined, just altered. Bed 9 did transfer the next day. General Warren Pike went to step down with a chest tube still in color-restored voice intact, and the kind of impatience that made every nurse on the floor instantly more optimistic. Ava was passing the room when one of the day nurses poked her head out and said, "He is asking for the one from the ICU." Ava stopped. The one what? The one who refused to let him die, apparently. That made refusing more difficult. When Ava stepped into the room, Pike was propped against pillows with reading glasses low on his nose and a cardiac rehab packet open in his lap, as if he intended to command his own recovery by force of stare. Without the sedation and machine burden, he looked older than he had in the ICU and more dangerous in a different way. Age had not softened him so much as distilled him. His chest dressing showed above the blanket. The line of his jaw had the blunt endurance of men who had spent decades being obeyed, and then surviving the years after that when command no longer came with a uniform. A woman in her 40s stood by the window. His daughter Ava guessed from the resemblance around the eyes. Pike looked up when she entered. So he said, voice rough but firm, "You are Bennett." Ava moved closer to the bed. "Yes, sir." He studied her in silence for a few seconds that felt less like inspection than calibration. Then he looked at his daughter. "I told you she would be younger than everybody made her sound." The daughter laughed softly and stepped forward. "I am Kate Pike. Thank you for coming." Ava gave a small nod, suddenly more aware of her own hands than she had been during the procedure itself. Gratitude from families often landed harder than emergencies. Emergencies told you what to do. Gratitude asked you to stand still inside what had already happened. Pike shut the rehab packet. "They filled in some blanks for me," he said. "Not all of them. Probably because doctors enjoy controlling the dramatic timing of information. But I know enough." His eyes stayed on hers. "I know a room full of important people missed what you did not." Ava said the only thing that felt true enough. The room corrected once we knew. Pike gave a quiet sound that might have been amusement. That answer belongs in a hospital brochure. Kate looked embarrassed, and not embarrassed at once. Dad. He ignored her. I spent 40 years around chain of command. Most of it existed for good reasons. Some of it existed because people prefer obedience to clarity. Knowing the difference matters more when the room gets expensive. Ava glanced toward the window, toward the city beyond it, then back to him. You do not owe me a performance of humility, nurse. I was unconscious, not stupid. Kate stepped closer to the bed and touched her father's wrist, the gesture of a daughter who had likely been doing that since childhood when his edges ran too hard. Pike's voice eased a fraction. My family was told there was a delay in recognizing the complication. They were also told you did not let that delay stand. Ava felt the heat rise to her face and hated it. I did my job. Pike held her eyes. Good. Keep doing it at exactly that level. Then he reached toward the side table where a fountain pen lay beside a stack of get well cards. He took a folded note from beneath them and held it out. Ava hesitated. Take it, he said. It is not money. If it were, my daughter would have stopped me. Kate smiled despite herself. Correct. Ava took the note. Open it later, Pike said. People always behave better when they do not know if they are about to be complimented or recruited. There it was again, that dry military edge under the illness. Ava tucked the note into her scrub pocket. Thank you, sir. His expression changed, then not softer exactly, but less armored. They said you were quiet in there, he said. Good. Quiet people usually hear the first crack before everybody else notices the wall is moving. Ava stood with that for a moment, then gave a small nod, and left before the scene could grow heavier than either of them wanted. She opened the note in the stairwell. The handwriting was angular and disciplined, not especially elegant. Nurse Bennett, you had the courage to be disobedient in the correct direction. That is rarer than talent and more useful under pressure. Warren Pike. No phone number, no signature flourish, no sentimental excess. She folded it once and put it back in her pocket. Over the next 2 weeks, Night Signal stopped being an emergency response to one catastrophic miss and started becoming part of the muscle memory of the unit. Not smoothly. The first time a first-year resident used it, an attending from another service complained to the supervisor that medicine was turning into committee theater. Crowe answered the complaint himself in 11 sentences, 5 of which were questions about an unrecognized line infection on that attending's service 3 months earlier. The complaint did not return. A respiratory therapist escalated a vent pressure issue in bed 2 at 2 in the morning. The patient turned out to have a kinked tube and worsening edema. Not glamorous. Still important. The escalation note was clean, the response timely, the outcome good. Beth taped the de-identified summary on the staff board with a yellow sticky note that read, "This is what the policy is for." A senior nurse who had spent years keeping her head down said in report one night, "I should have pushed harder on a case last spring." She did not say more. She did not need to. 3 people at the station went quiet in a way that suggested each of them had their own spring. The first staff huddle after the policy launch felt tense enough to crack. Crowe attended in person. No preamble, no motivational speech. He stood near the central station with coffee gone black in a paper cup and told the room, "I am not asking you to become loud. I am requiring you to become early." Then he left before anyone could clap argue or turn it into a poster. Ava found herself becoming visible in ways she had never wanted and could not entirely avoid. Newer nurses asked her what exactly she had seen in Pike's chest movement. Residents who had previously spoken past her now paused when she answered a question at bedside. Ellis began consulting her on vent patterns during handoff because, as he put it one night while checking a circuit, "You look at people before you look at the equipment, and I need that near me." She disliked being treated like a symbol. Symbols got flattened. They lost the messy interior logic that actually let them function. But she understood enough about institutions to know that people needed a shape to attach change to. For the moment, like it or not, she was that shape. 1 month after Pike's event, she walked into bed 3 at 1 in the morning and found a newly hired nurse named Lily Ortiz standing near the foot of the bed with the rigid stillness of somebody trying not to panic in front of a resident. The patient, a 50-year-old man recovering from valve replacement, looked off. Not crashing, not right. Lily saw Ava and stepped closer at once. "Can you look at this?" she whispered. Ava moved beside her. The resident, a second-year named Harper, was tapping through labs at the bedside computer without turning. "We have the EKG. It is artifact and anxiety." Lily's voice stayed low. "His rhythm strip keeps changing shape." Ava looked at the monitor, then at the patient's face, then at his hands. Damp skin. A different kind of restlessness under the blanket. She leaned close enough to hear his breathing over the room sounds. "What do you see?" Ava asked Lily. Lily swallowed. "His color is worse than 10 minutes ago. He says he feels pressure but not pain." Harper half-turned, already prepared to dismiss another layer of concern. Ava did not let him get there first. "Hold on," she said. "Not loud enough." Harper stopped. Ava looked back at Lily. "Say it exactly like that." Lily blinked. "Now." "Now." Lily faced the resident's shoulders tight and said, "His color is worse than 10 minutes ago and he feels pressure. I do not think this is just anxiety." Harper stared at the monitor again, then at the patient, then finally at the patient with actual attention. The difference was visible. He set down the tablet, stepped to the bedside, and placed a hand on the man's forearm. "When did that start?" The patient answered. The resident listened. A second EKG was ordered. Labs repeated. Cardiology notified early rather than late. The issue turned out to be a conduction problem beginning to declare itself before the monitor interpretation caught up. Not a dramatic save. No chest tube. No shouting. Just a life kept from drifting into danger because a new nurse spoke while the problem still looked deniable. Afterward, Lily stood at the sink with flushed cheeks trying to wash her hands and adrenaline off at the same time. "I thought he was going to make me feel stupid," she said. Ava dried her own hands and handed her a towel. "He might have." Lily looked up startled. Ava shrugged lightly. "That cannot be the deciding factor." Lily gave a shaky breath that turned into a laugh. "You are terrifyingly calm." "No," Ava said. "I just know what it costs to let the room decide for you." Lily folded the towel and threw it away. "Did it get easier?" Ava thought about Crowe Caldwell Pike, the laminated policy sheet, the conference room, the way the unit had looked at her since that night. "No," she said. "It got clearer." That was enough for Lily. She nodded and went back to charting. Late the following week, Ava found a small envelope in her locker with no stamp and no note on the outside. Inside was a copy of an internal memo from Crowe's office announcing a permanent review of escalation barriers across critical care units. Attached to it was a single line typed on plain paper. Accuracy scales. No signature, none needed. Beth, when shown the note, said, "That is somehow the most affectionate thing he is probably capable of." Ava put the paper back in the envelope and slid it into the back of her locker. Pike's chest tube came out. He walked his rehab laps. He left the hospital under his own strength 6 days later with a carefully controlled expression that almost hid how close he had come to leaving it another way. Before discharge, he sent a box of expensive bakery pastries to the night shift with a card addressed only to bedside staff who actually look. The card disappeared within minutes. The pastries did not last that long. Caldwell's service changed too, though, in smaller, quieter ways. He began asking bedside nurses what changed first before he launched into his own interpretation. The first few times he said it, the residents around him looked more shocked than the nurses did. He never became warm. No one expected that. But he became more permeable. In critical care, that mattered more. 2 months after bed 9, during a heavy thunderstorm that rattled the high windows and turned the city into sheets of reflected light, Ava stepped out of a patient room and found Crowe standing at the central station reading a chart while rain flashed silver beyond the glass. He looked up. "Bennett, sir." He tapped the chart once with a finger. "Good catch on 7. She knew the case immediately. Electrolyte imbalance. Subtle signs before lab confirmation. Nothing dramatic. "Thank you." Crowe set the chart down. "Caldwell followed your recommendation without argument." Ava said nothing. Crowe glanced toward a room where a resident was listening to Lily of all people now with visible attention. Then he looked back at Ava. "This place was built by experts," he said. "That was never the problem." Rain rolled down the glass in blurred bands. The central station glowed under nightlights. Ellis laughed at something Beth said and then caught himself because laughing too loudly still felt almost illegal on the 12th floor. A patient call light went on and off. Somewhere down the corridor, a family member was being led gently back to a waiting area. Crowe's gaze moved over all of it. It needed people who could hear the first wrong note before the whole room called it music. He picked up the chart and started to walk away, then stopped after 2 steps. "Do not get comfortable." Ava almost smiled. "I was not planning to." "Good." He kept walking. That was the nearest thing to approval she ever got from him, and it was enough. Winter arrived late that year. San Antonio gave them cold mornings, hard blue skies, and one brief ice warning that sent the city into disproportionate discussion. Inside Liberty Cross, the ICU remained seasonless. Machines, light blood pressure, pulse, oxygen, breath. It could have been any month and any year from the inside. Ava was still one of the youngest people on many of her shifts. She still tied her hair back the same way, still checked equipment with the same disciplined habit, still preferred clear notes over clever ones, still felt a pulse of cold through her chest every time a room began leaning toward the wrong conclusion too quickly. The difference was not that fear had left her. The difference was that she no longer mistook fear for a command. One night, near the end of that winter, she stood in the corner of a room while an attending 2 residents and a pharmacist discussed a complicated medication question over a patient whose monitor looked almost reassuring. The patient's wife sat in a chair by the window, twisting a tissue in both hands. The air in the room had that familiar charged quality, the one that often preceded someone deciding whether to speak. Ava watched the patient's breathing, then the neck, then the screen, then the patient again. Across the room, Lily caught her eye from beside the IV pump. The younger nurse did not say anything. She did not need to. She just straightened slightly, ready. Ava felt the unit around her, the policy on the wall, the conference room paper trail, Crowe's cold precision, Marisol's dry steadiness, Beth's gossip and watchfulness, Ellis checking pressure curves, Caldwell learning to ask before declaring, Pike's folded note in the back of her locker. The accumulated force of many small corrections added to one large one. Then she looked back at the patient and spoke into the room with the same level voice she had fought to keep when nobody wanted it there. "His work of breathing is changing." This time the room turned toward her immediately.